why don't we go ahead and get started? Like I'd mentioned, and joining early for this August education call on choosing a dialysis facility. I'm going to try my best to speak as slow as possible. I tend to get a little bit nervous and rush through things. So if that does happen throughout, please let me know. I'm more than willing to repeat or go back. But we wanted to present an education call that sort of goes over the resources you have to check the quality of your facility, whether you're moving or looking to switch, or if you're in late-stage CKD and maybe looking for a facility for the first time. So first, let's just briefly discuss, I guess, the role of your dialysis facility. So after you've been diagnosed with end-stage renal disease, you must choose a renal replacement therapy option, which in turn will likely need you to find a dialysis facility. If in-center dialysis is the best choice for you, then it's important to remember that you'll spend at least 12 hours a week in that facility. And the dialysis facility's role is threefold for you as a patient. It provides your renal replacement therapy, whether in the form of hemodialysis, or it also provides the training for home therapy, such as peritoneal dialysis or home hemodialysis, if you choose a home therapy, and also provides you that care team to support your needs as a dialysis patient, with nurses, social workers, patient care technicians, and dietitians. So if you do choose to go in-center, that care team you'll see on a 3 times a week basis, whereas at home you may only see them in person once a month or so, but you'll still have access to them to answer questions or meet your needs. So how do you go about choosing a dialysis facility? When you choose a facility, you have a couple of resources available. First, the Centers for Medicare and Medicaid Services, or CMS, they have a dialysis center finder tool, also known as Dialysis Facility Compare. So the site allows you to search for facilities within your zip code, or if you type in your city and state. After you type in your zip code, you'll see a listing of facilities within 50 miles, and there are 7 different columns of information. If you're online, you'll see there's a walkthrough where I went and typed in my home zip code back in Michigan. So typing in 48049 gives me up to 12 facilities within 50 miles. And once on that page, it gives you those 7 columns, which gives you the dialysis facility information, its overall star rating, its distance away from the zip code you entered or the city-state, whether or not they have nocturnal dialysis or shifts starting after 5 p.m., if they do provide in-center and how many stations they have or chairs, if they provide peritoneal dialysis, or if they provide home hemodialysis training. So once you do type in your zip code or city-state, you're able to scroll down and see all of your options. It's default sorted by distance, so the closest one to whatever you type in will show up first, and that's where you can sort of see and compare right away their star rating, their distance, if they have the services you need, such as peritoneal dialysis or in-center hemodialysis, or even home training. So that first, I guess, piece that you're going to notice is the star rating. And so in 2014, CMS decided to include star ratings for dialysis facilities to try and help patients determine the quality of the facility. However, the system doesn't necessarily work as you would expect or as you're familiar with typical star rating systems. The dialysis facility star rating system distributes ratings along a bell curve, meaning that 30% of the facilities will receive a 1 or 2 star rating, 40% will receive 3 stars or will receive 3 stars, and 30% will receive 4 or 5 stars. So because of the way that they choose to distribute these ratings, it's important to note that a 1-star rating does not mean that you will be receiving poor care. It means that the facility was below the average in comparison to other facilities. So like you may be familiar with, if you see a 1 or 2 stars for a movie, to you that would likely mean that you shouldn't go see that movie. It's going to be a waste of your time. But according to CMS, a 1-star facility does not mean that you will receive poor care. It just means that, like I mentioned, that the results were below average compared to other facilities. In online product reviews, most products receive 4 or 5 stars, but in this case, only 30% of all facilities can receive 4 or 5 stars. And Dialysis Facility Compared does not evaluate the physical condition or the amenities of the clinic. It's based on clinical measures only. And they do not the facility ratings do not consider patient satisfaction, and the rating could be low in part to things that are outside of the facility's control, such as patients following their doctor's recommendations, or even just the area they're serving and the population they serve. So if you do use that Dialysis Facility Compare tool and notice that there are more 1- and 2-star facilities in your area, it may be because your community maybe overall it's less healthy or economically disadvantaged. That doesn't mean that those dialysis facilities are going to provide poor care. If you are viewing online, we do have a copy of our fact sheet on the slide, which shows some states in red and green. So the map on the slide with the green states and the darker shade of green shows more healthy states overall, and they generally have the highest concentration of 4- and 5-star facilities. Whereas the red states on the map have either higher poverty rates or poor overall health and tend to have the highest concentration of 1- and 2-star facilities. So it's important to note that while the star ratings can help guide questioning for a facility choice, the decision shouldn't be made solely based on whatever star rating that facility has received. So if you're searching for a facility or even search for a new facility, or you're searching for your own facility and you're concerned about the star rating that the facility has been given, consider asking the following questions, both of yourself, or if it's something that you're unable to answer, feel free, of course, to ask a dialysis facility staff member. So many of you if you're a current dialysis patient, you should be aware of the Quality Improvement Program. So one of the questions to ask would be that, does that score posted in the facility indicate that the facility is meeting the standard on measures of quality? For those of you who may be late-stage CKD and not in a facility yet, dialysis facilities are also measured on another set of quality measures, and those are reported in the facility each year, whether it meets the standard or is below standard, and that also affects their reimbursement rate. So if you're currently in facility or you're looking for one and you're concerned about the star rating, asking how they performed on that quality incentive program is a good question. You can also ask when the last CMS inspection of the facility was completed and what the results of that inspection was. If the facility is a 1 or 2 star, is it the only one in the region, or do other nearby facilities have similar ratings? If you're looking online using that Dialysis Facility Compare tool, you should be able to sort of gauge that yourself. But if you only have one facility in the area, it's perhaps worth looking at nearby zip codes to see if it's a trend or if maybe yet one facility is an outlier. And then if you are following along online, you'll notice the questions changed colors. So these questions in yellow are more so questions that you can ask sort of yourself or of something that you can observe in your facilities. These are things that are patient affected or patient, I guess, questions that could be answered by other patients. So do most of the other patients in the facility adhere to the care team's advice about diet and fluid, etc.? So if you are in a facility currently that has many non-compliant patients, so they are less healthy, that is likely going to affect the star rating. So it's a question to ask either the care team or just sort of think about when you're looking at that rating. Also consider your own monthly lab numbers. Are they in the proper range? How are you doing to try to be as compliant as possible? Does the dialysis facility staff listen to you and address your needs if you're currently in a facility? And how well do you actually feel during and after dialysis? Do you receive clear and understandable advice from the staff in the facility, such as the dietitian, nurse, and social worker, about what your role is improving your health? And last